number of years, and in quite a short time frame as well.
Van Turnhout.
Thank you very much. Minister, last December, sorry, Cahir, look, I think it's a different minister.
Oh, you're not doing this, Minister, sorry. Were you doing any other ones, Minister? Okay. Minister. Senator Van Turnhout.
Minister, last December I praised the budget 2012 commitment to invest £35 million into mental health services, of which £23 million was dedicated to developing community mental health teams for adults and children. I, along with many others with an interest in mental health, was alarmed to read a newspaper report over the weekend in the Irish Times that part of the £35 million investment in mental health services could be used to offset overruns in the HSE. This report was swiftly countered by your Cabinet colleague, Minister for Public Expenditure and Reform, Brendan Howland TD, who gave assurances on the RTU Radio 1 programme this week on Sunday that the additional post promises for mental health services would be delivered. So, Minister, I firstly want to ask that you would take this opportunity to give me the same assurances in this regard. In Budget 2012, a further commitment was made to recruit 414 staff for community mental health teams, of which 250 posts were to be dedicated to adult teams. And I'm extremely disappointed that not one position has been filled, and it's now July 2012. Minister, you more than most are very acutely aware of the wide-ranging benefits of community-based mental health services. Amongst many other benefits, community-based mental health services, they enable someone to be treated for mental distress in their own community, either at home or at a hospital. They allow inpatient or day hospital stays to be minimised. They liaise with local community services such as vocational training, education, housing, voluntary support services to provide an integrated recovery support to the individual. And they support staff in primary care services to provide mental health support. Furthermore, having accessible mental health services in the community can help to normalise mental health and destigmatise mental health problems, reducing the prejudice and discrimination that people currently face. Community mental health teams are, in my opinion, a vital part of the recovery ethos, which is central to a vision for change. And the community-based mental health services envisaged in a vision for change are specialist services with staff that have particular expertise in supporting a person's mental health. Core services offer a holistic range of supports and include staff from a range of specialist disciplines, including clinical psychology, mental health nursing, occupational therapy, psychiatry and social work. However, the specialist disciplines mentioned remain significantly understaffed. Back in 2010, the Inspector of Mental Health Services report on an audit of community health staffing showed that only 50% of the required psychologists and only 60% of the required occupational therapists were in place. In addition to my concern over the existing understaffing, I am concerned by the reports from the coalition group Mental Health Reform that the Irish Mental Health Commission is no longer collecting data on staffing levels in approved centres. The gap in data will make it extremely difficult to assess whether or not staffing levels are reaching the recommended level as set out in a vision for change. So my second ask to the Minister is to hear what information you have in this regard, and perhaps you could provide me assurances that data will be collected. And Minister, you recently confirmed that 31 of the promised 414 posts allocated for the community mental health teams in HSE Service Plan 2012 will be converted to nursing posts for acute inpatient services in Dublin Mid-Leinster region. Mental health services in Ireland have far too long been the Cinderella of our health services. The 414 staff promised in the HSE Service Plan should not be deployed into inpatient services. They must remain in the community. Staffing needs to be ring-fenced. And Minister, in ending the continuing uncertainty over the future of the mental health budget does nothing to allay fears of the government's commitment to invest that dedicated £35 million, as I mentioned at the start. So my third and final ask, Minister, is can you confirm that the badly needed posts for community mental health teams will be in place by September, and will these posts be ring-fenced to ensure that they are not diverted to inpatient services?
Thank you very much. I'm always reluctant to read a script, and as the last script got me into so much trouble, I'm even more reluctant. But anyway, I'm always reluctant to read a script when it comes to when it comes to mental health. But there is an element of this that you really do need to hear. Dublin Mid Leinster had a significant shortfall of nursing staff in the mental health service, but compares favourably to the other regions in relation to the numbers of allied health professionals. The nursing staff ratio in the region is far less than that of other HSE regions, and the number of allied health professionals in Dublin Mid Leinster, as I said, compares favourable. It should also be noted that Dublin Mid Leinster had made considerable progress in reducing acute bed numbers and usage in line with a vision for change. It is now at a point where existing acute bed numbers need to be broadly maintained to ensure a safe and regulatory complement level of service. Basically, what happened in relation to the 31 posts and the conversion was that Dublin Mid Leinster had reached the level that Vision for Change required far quicker than anyone else. But then what happened was, in relation to the exodus in February and March, they actually fell below the safe levels that the Commission recommends and insists on. So it was necessary to convert some of the posts into nursing posts. That did not affect their allied health professional posts either. We managed to put those in place as well. You weren't the only one that was surprised at the weekend reports in terms of that the 35 million could possibly be used for other areas, because just that week I had been in consultation with Brendan Howlin again and had confirmed to me that the 35 million was still safe and sound in the department. And it is still in the department, by the way. Basically, what normally happens in relation to budgets for any health service is that when the mental health budget was announced and the 35 million was announced, then the RDOs, who do an extraordinary job in delivering the service, including Dublin Mid Leinster, they contact the department and say, look, would you split up the 35 million and send it down to us per rata? You know, that's always how it's done. You know, our budget for last year was X and we need X this year, so would you send it down? So we said no. In this instance, no. What we want you to do is carry out a gap analysis. Tell us what you're missing, where they're missing, and what you need to put in place. And until that exercise was done, then none of the 35 million will be released. That, as you can well imagine, takes a degree of work and investigation, and also, once it was then signed off on, they had to then go away and recruit and take off panels that already exist, but in some instances, in some allied professionals, we didn't have enough on the panels, nor did we have, some of the panels had run out. They only last 2 years. But that is all now being done, and they will be in place by this coming September, and then the money will be released. I know it might be, some people might say it's a lack of trust, but we all know what happened to budgets in relation to mental health in the past, and we were determined it would not happen this time. So they will be in place come September. We will have a full complement of allied health professionals, but there are areas which didn't get anything this year. CAMS, for instance, got 150 new posts, but the payback for that is that they will have to treat people from 16 to 18 because they're children, and you know, that's it, that's the payback. 250 new posts in terms of adult psychiatric services, 10 new posts in terms of the National Counselling Service. So all of that is being put in place. But there were 3 areas that we didn't do anything with this year, and they've come in and they've met us, and they know that they'll be a priority area next year, and they're happy enough about that. Old age psychiatry, intellectual disability psychiatry, and forensic psychiatry. We couldn't do it all in 1 year. It will be done over a period of years. I think people are in relation to data. I've said it before and I'll say it again. We have real-time data in terms of children and who's been treated, where they've been treated, what they're being treated for, and by whom, and what's their pathway, how long they're going to be in the service, when they're going to come out of service. And that's from a service that has been in existence for about 12 years. In adult psychiatric services, we still don't have that type of detail. And, you know, when you consider that that information was gathered by way of a pencil and a biro and the systems we have in place now. Surely that type of information needs to be real time as well in the adult psychiatric services. Some people are very good at it, some people not so good. That's just not good enough. We have a difficulty as well in terms of, and the conversion of the post was part of this, insofar as the Mental Health Commission licenses the acute unit, so therefore there are levels of staffing and all of that that need to be complied with. We intend, under the review of the Mental Health Act, to licence the community teams as well. So you will have parity. There will be parity there. So, you know, I'd love to have a half an hour to talk about this. It's probably my favourite subject, and I think that tells you something about me. But in saying that, I think we are moving ahead. I think as well the capacity legislation, which will have to dovetail with the Mental Health Act, I think will all give that sort of degree of safety and that net. There are already community mental health teams in operation in Cork North Central that I'm sure the Senator would be familiar with. John McCarthy lived there, and it is working extremely well. You know, there are daily visits to people who need it, and I have great reports of it. We should have that everywhere. And I thank the Senator for raising it.
Questions?
Thank you very much, Minister. And you know yourself the value of community model mental health services. And I suppose my question is just to say that I will continue to follow this issue. I really do appreciate your comprehensive response that you've given us here today. But I think you only need to come into the Seanad any day of the week to hear the effects of these services not being in place. We hear again and again by my colleagues in the Seanad. So it is something I think we need to fast track and get these posts in place. So it is something I will be coming back to. And of course you have our support in the work you're doing.
Well, can I just... I suppose that when the teams are in place, I think as well as managing expectation, when the teams are in place, we have to be very conscious of the fact as well that teams do have to have a settling in period, and they do have to gel in order to work well. And also they need to know what we expect from them. I think that's important. That's very important. And as well as that, we need to start looking at, you know, now that we have what Vision asked us to do, you know, the table of the groups and the teams and all the rest of it. And that's really what Vision was, where they should be, who they should serve, and what the table was. I think we need to start looking beyond that now, and we need to start planning that process. Like, if we have the teams now, what do we expect of them? And what do we see our mental health services being?
The data is important.
Minister, you're taking the other ones.
I am.
Senator Hart.
Minister, thank you for coming in. My matter to the